All right, hey everybody, my name is Connor. I'm with McCady Hospital, and today I have Dr. Husain, one of our heart failure cardiologists at the McCady Heart Failure. Just have you here today to kind of talk about what heart failure is, the signs and symptoms, how I can prevent it, or how you can prevent it. So thank you so much for joining us today. We're glad to have you here as a part of Heart Health Month.
Thank you.
Yeah. So let's maybe first jump into what heart failure is, because obviously it kind of sounds, you would think you know what it is, but what exactly is it?
So heart failure, when you tell a patient you have heart failure, it's kind of a scary term.
Yeah.
But basically heart failure is when heart is not able to work as a pump efficiently. So heart is a very central organ in our body. It's a pump. So it fills in with blood and then it ejects blood to all the organs in the body. So it's perfusing or supplying nutrition and oxygen to all the organs.
Okay. So what, when heart failure happens, is it just sending less blood out? Like what part of that is the failure?
Good question. So heart failure comes in two flavors. One is when heart is stiff and it cannot fill efficiently with blood.
Okay.
That's called heart failure with preserved ejection fraction. So imagine this is like a balloon, a brand new balloon that you get from store.
Right.
If you try to blow air into it, it's hard to blow air into it.
I tried that earlier.
Yeah, so it's hard. So the air remains in your mouth. The same thing is with heart. Failure preserved ejection fraction, heart is tight and the blood is all accumulating back in the lungs. So people get congested and get short of breath. That's one kind of a heart failure.
So blood can't go into the heart?
Into the heart, good.
Okay.
The other kind of heart failure is heart failure with reduced ejection fraction or systolic heart failure, is when the heart is not able to squeeze out the blood. So heart works, it should clap like this. Okay. And when it doesn't, so the blood is not going out.
Okay.
Again, the lungs get congested, all the organs behind, so the legs get swollen. So that's called heart failure reduced ejection fraction. A tight heart and a wobbly, weak heart. That's two different kinds.
Okay. So for those of you who are watching, if you have questions while we're going along, please comment them. Who's behind the camera will say that question out loud to us, so you can actually ask her some of your questions. So just keep that in mind. So obviously we know now kind of what heart failure is. It does sound scary. What are kind of the signs and symptoms? You mentioned legs, maybe some pain somewhere else. Kind of explain that to us. Yeah,
the symptoms and signs and symptoms are shortness of breath and where it's coming from, because the blood is getting all pulled back in the lungs, so patients get short of breath. Swelling in legs. New onset heart failure, they present with just lower extremity swelling, legs are swollen, or shortness of breath. Sometimes people end up in Instacare or emergency room thinking that they have bronchitis. They may have cough. They may have symptoms that mimics or looks like upper respiratory infection.
Interesting.
So that can be just a way that heart failure is presenting.
And shortness of breath would be like me sitting right here having a hard time breathing.
Or if you say, for instance, you were an active person, you could walk several blocks and now taking a flight of stairs, you are huffing and puffing.
Okay.
Or your usual activities are making you short of breath, which were fine before.
And swelling in the legs, I guess I've never had it. What does that look or feel like? Should there be pain associated with it, or?
Pain is not that very often, but it's just that, your shoes may not fit, your socks may leave marks, and then you will notice that your legs are getting puffier, and they can feel heavy. But when the swelling is a lot, the skin may tear up, and you can have some pain from that. But usually, it just visually people can feel, or they can feel that the shoes or their socks are not fitting them well.
Okay. And mostly in our feet is kind of where our legs and feet is kind of where this happens. Why doesn't it happen up in our arm? What's about our legs that
if that swelling is left unattended for a long period of time, and the congestive heart failure is untreated for a long period of time, that swelling can get so worse that it can climb up climb up to the thighs, can get to the belly, and usually we don't see that much swelling with upper extremities or arms. That usually we see if people are losing a lot of protein or they are not able to absorb a lot of protein, and when that comes, then the whole body can get swollen.
Okay. Interesting. So besides maybe blood flow, by the way, back up, does that ever lead to blood clots? Like, where does that fall into this at all? Or?
Well, it can be a risk factor. What happens is that, imagine the heart is not squeezing the blood, everything is like stagnant, sitting, the blood is pooling everywhere. So any time when there is pooling of blood, especially in legs, and people are not able to walk because of that swelling, that always gives rise to having clots. It's a risk factor.
Okay.
Sometimes they can be clot in the heart, because if the blood is just sitting and pooling and the heart is all stretched out, so
it can happen there as well.
It can happen there as well.
Okay. So maybe besides that, what are some of the other effects that it can have on our body? So we've mentioned legs and feet. Am I going to notice anything else, or would you notice anything else? Or if you go to the Instacare emergency room, what are they looking for?
Cough, as I said, because the swelling is all over the body, it's inside the body, in the gut. So when the gut is swollen, it's not going to absorb the nutrition. So people may actually start losing weight.
Okay.
The liver can get congested, again, because the blood is not flowing. And when that happens, there can be yellowish eyes because of the bilirubin going up.
What was that again?
Bilirubin. It's a pigment that's produced in the liver, and that should be flushed out, but because of the blood pooling in the liver also, that can elevate the level. It's called bilirubin, or people know it by jaundice. They can have that yellowish hue.
That's what I've heard.
Yellowish hue to the skin. And they can, sometimes if the clot is in the heart, they can present with stroke.
Okay.
Because that clot can go and migrate to the brains. So there are different ways how congestive heart failure may present. As I said, poor appetite, just being tired, not able to do daily chores, unable to sleep flat, lay flat, and sometimes people just feel comfortable sleeping in a recliner because the head is elevated.
Right. That's interesting. So that's those are the signs and symptoms of kind of maybe needing to go get checked out. Would you have pain? You mentioned like your liver. I know that kidney can also be affected by that. Are you going to feel pain, sensation, anything like that? Or
so with kidneys, because what happens, the kidney function can deteriorate, and the reason why is because heart is a pump and it's supplying blood to all the vital organs. So the kidneys, the way they perceive is that they are not getting enough blood.
Right.
And because of that low blood, the filtration also goes down. So people can have kidney failure from that. Pain, as you said, people can feel abdominal or in the belly, they can feel this dullness, that dull ache, or feeling bloated. A lot of times people will not say that I'm that short of breath. They say that when I bend, I get very short of breath, or I just have this bloating sensation. So
if you constantly maybe feel bloated, that could also be a sign of what's going on.
It's just because there's congestion inside the belly.
Right.
And if the liver gets congested, so the liver is covered with covering, and it gets just stretched out. So that makes sense. So people may have just pain or dullness of dull pain in the liver area. Okay.
So how would I go about preventing this? I mean, I feel like there's some obvious answers, but what would you recommend for, maybe someone my age in their 20s, 30s, 40s, kind of how would you break that up?
As I say, that prevention is the best intervention that we can do for congestive heart failure. So if we start from the beginning, from scratch, so lifestyle is very important. So keeping the blood pressure in control.
Okay. And how would you do that?
the best way would be to stay away from salty food, exercise. If people have sleep apnea, to use the CPAP, lose weight, getting diabetes under control, because all these problems like hypertension, diabetes, it gives birth to other complications like coronary artery disease. And all these problems together, they attack the heart.
Okay.
So keeping a good, following a good balanced diet is important. Stop smoking, staying away from alcohol, avoiding fast food. All this keeps, of course, your blood pressure in control. Also keeps your weight in check. Right. And then, we have no control over genetics. But as I said, that if somebody has a family history for heart disease, if we are very adherent with the lifestyle changes, then even if we were to get sick or have congestive heart failure, it wouldn't be that severe or that bad.
Right.
Because of course there is genetic predisposition which we have no control over, but whatever we can do ourselves, it can really have a huge impact on the disease.
So basically what I heard was that I need to book an appointment with you because of all of the signs and symptoms, maybe not eating super healthy or whatnot.
If you don't listen to me, then you'll have to make an appointment with me.
I'm going to listen. I'm going to go watch this video over and over again to make sure that I'm paying attention, all those things. So, so it sounds pretty simple. So we kind of, just for everyone watching, kind of what heart failure is, just basically the heart isn't being able to pump blood either into it or out of it. So the heart kind of sounds like a sponge in a way. Is that kind of what it would feel like? I don't know.
Not a sponge, but like a balloon.
Okay.
Like you blow air into it, and then you squish it, and the balloon goes. It deflates. Okay.
And then kind of some of the signs and symptoms: swelling, maybe bloating. Those
Cough.
Are kind of simple ones. Cough. And whatnot, and then it can affect your kidneys and lungs and stuff like that. So is there any questions that maybe I didn't ask you that you commonly get asked by a patient when they come and visit you or when you're seeing one?
The question I get asked a lot is, of course, it's very hard for people to stay away from salt. So, we try these medications that make the heart stronger. So they ask, is it just going to be a temporary thing? Or is going to be lifelong? And the answer is lifelong.
Okay. So I should tell my sister-in-law to stop putting all the salt she adds to every single meal. She adds, literally at the dinner table, we only put salt out for her, and she grabs it and shakes it. So I'm going to have to send her this video after we're done. So, cool. Well, thank you so much, Dr. Husain, for being here, and we really appreciate it. For any of you who have questions, continue to comment them, and we'll try to reach back out to you for answering them or get you to the right provider. So thank you for joining today, and everyone have a great day.